Today, we're diving into one of the body's master control systems. We're talking about a single chemical signal that can dictate everything from your heartbeat to your ability to focus. And we're going to uncover the powerful drugs that act like on and off switches for this system, giving us this incredible power over our own biology.
So let's start with a bit of a puzzle. How can one single chemical messenger slow your heart down, make the pupils in your eyes smaller, and make your muscles contract all at the same time? I mean, that sounds kind of contradictory, right? Well, the answer reveals one of the most elegant designs in our entire nervous system.
And that brings us to the hero of our story, a neurotransmitter called acetylcholine, or ACH for short. You got to understand, this tiny molecule is an absolute powerhouse of communication. It's the primary signal for a huge range of what your body does without you even thinking about it. Okay, let's zoom way in and see this thing in action. Inside a nerve terminal, acetylcholine is built from a couple of building blocks. Then it gets packed into these little bubbles called vesicles. When the nerve gets an electrical signal, boom, these vesicles release ACH out into the gap between cells. It travels across, delivers its message, and then, and this is key, an enzyme called acetylcholinesterase, or ACHE, immediately swoops in and breaks it down. It's this super precise, incredibly fast cycle of go and stop.
So this whole song and dance, the making of acetylcholine, releasing it, and then cleaning it up, that entire process is what scientists call cholinergic transmission. It sounds fancy, but really, anytime you hear the word cholinergic, just think, this is the system that runs on acetylcholine. Simple as that.
But of course, sending a signal is totally useless if there is nothing there to receive it. For acetylcholine to actually do anything, it has to physically connect to a specific receptor on the target cell. You can think of it like a key needing the absolute perfect lock to work.
Now, this is where it gets really cool. Acetylcholine has two very different types of docks it can land on. They're called nicotinic and muscarinic receptors. And get this, the exact same signal, acetylcholine, can trigger completely different actions, all depending on which of these two receptors it binds to. It's a brilliant bit of biological efficiency. First up, we've got the nicotinic receptors. These are the fast responders, the sprinters. Think of them as simple on switches. When acetylcholine hits them, they immediately open up a channel and get the cell all fired up. You find them in places where you need speed, like where your nerves tell your skeletal muscles to contract right now, or in these major nerve relay stations called autonomic ganglia.
And then we have the muscarinic receptors. These guys are the modulators. They're much more like dimmer switches than on-off switches. They're way more widespread throughout the body, and their effects are a bit more nuanced. You've got M1 receptors in the brain and glands, M2 receptors that tell the heart to slow down, and M3 receptors pretty much everywhere else. Glands, smooth muscles, even the eye. They're all about fine-tuning our organs.
So now that we kind of get the system, we can start to see how we could, influence it. What if we wanted to amplify that acetylcholine signal, make it stronger? Well, that's exactly the job of cholinergic drugs. When you boost the signal, you get effects all over the place. The heart rate slows way down. Blood vessels relax, which can cause blood pressure to drop. Smooth muscles in your gut and bladder start contracting more. And your glands, they go into overdrive, pumping out more saliva and sweat. You're basically turning up the dial on the rest and digest part of your nervous system. And here's a perfect clinical example of this in action. In the eye, these drugs hit the M3 muscarinic receptors. This makes the iris contract, which shrinks the pupil. That's a process called meiosis. But just as importantly, it opens up these tiny drainage channels inside the eye. For someone with glaucoma, that's huge because it helps relieve the dangerous high pressure.
Now, there are two really clever ways that drugs can boost this signal. First, you have direct-acting drugs. These are like master keys. They're shaped just like acetylcholine, so they can fit right into the receptor and turn it on themselves. Then you have the indirect-acting drugs. These guys are more like bodyguards for our own natural acetylcholine. They work by blocking that cleanup enzyme, ACHE, which means our own signal hangs around in the synapse for much longer, giving it a stronger effect.
So let's look at a couple of real-world examples. That glaucoma treatment we just talked about, that's often a direct-acting drug called pilocarpine, used in eye drops to relieve that pressure. And sometimes after surgery, the bladder and gut can get a little sluggish. Well, another direct-acting drug, bethanical, can be used to wake them back up and get them working again.
The indirect-acting drugs have some truly life-changing uses. In a disease like myasthenia gravis, where the signals from nerves to muscles are really weak, these drugs prevent the ACH from being broken down, which makes the muscle contractions stronger. And in Alzheimer's disease, where we know the brain's levels of ACH are lower, these drugs help maximize the impact of the signal that's still there.
Okay, but what if we want to do the exact opposite? What if the problem isn't a weak signal, but a signal we need to turn off? Well, for that, we turn to the other side of the coin, the anticholinergic drugs. Their whole job is to block the signal from ever being received. These drugs, especially the ones called antimuscarinics, are what we call competitive blockers. They are shaped perfectly to fit into the muscarinic receptor. But, and this is the important part, they don't activate it. They just sit there. They physically occupy the space, blocking our natural acetylcholine from binding. It's literally like putting the wrong key in a lock so the right one can't get in. Now, blocking this system has such distinct effects that for generations, medical students have used this slightly creepy but super memorable little rhyme to remember them all. It goes, hot as a hare, blind as a bat, dry as a bone, red as a beet, mad as a hatter. And here's what it all means. Hot as a hare, because you can't sweat so your body overheats. Blind as a bat, because your pupils dilate, making your vision blurry. Dry as a bone, because all your secretions, saliva, everything, dry up. Red as a beet from flushed skin, and mad as a hatter because it can cause confusion and even delirium. So despite those pretty intense potential side effects, blocking the cholinergic signal is incredibly useful in medicine. These drugs can prevent motion sickness, they can open up the airways for people with asthma, they're used during surgery to keep airways dry, they can even help reduce the tremors in Parkinson's disease, or calm down an overactive bladder. It's a remarkably versatile tool. And all this leaves us with a final thought to chew on. We've seen how we can very precisely turn up or turn down one of the most fundamental nerve signals in the body to treat everything from glaucoma to Parkinson's. It really makes you wonder, as our understanding gets even more sophisticated, if we can control our nerve signals with this level of precision today, what does the future of treating even more complex brain disorders look like tomorrow?